1910.1001 Appendix H, Medical Surveillance Guidelines for Asbestos, non-mandatory. Appendix I to Section 1910.1001 Medical Surveillance Guidelines for Asbestos, non-mandatory. I. Route of entry. Inhalation, ingestion. 2. Toxicology. Clinical evidence of the adverse effects associated with exposure to asbestos is present in the form of several well-conducted epidemiological studies of occupationally exposed workers, family contacts of workers, and persons living near asbestos mines. These studies have shown a definite association between exposure to asbestos and an increased incidence of lung cancer, pleural and peritoneal mesothelioma, gastrointestinal cancer, and asbestosis. The latter is a disabling fibrotic lung disease that is caused only by exposure to asbestos. Exposure to asbestos has also been associated with an increased incidence of esophageal, kidney, laryngeal, pharyngeal, and buccal cavity cancers. As with other known chronic occupational diseases, disease associated with asbestos generally appears about 20 years following the first occurrence of exposure. There are no known acute effects associated with exposure to asbestos. Epidemiological studies indicate that the risk of lung cancer among exposed workers who smoke cigarettes is greatly increased over the risk of lung cancer among non-exposed smokers or exposed non-smokers. These studies suggest that cessation of smoking will reduce the risk of lung cancer for a person exposed to asbestos but will not reduce it to the same level of risk as that existing for an exposed worker who has never smoked. 3. Signs and symptoms of exposure-related disease. The signs and symptoms of lung cancer or gastrointestinal cancer induced by exposure to asbestos are not unique, except that a chest X-ray of an exposed patient with lung cancer may show pleural plaques, pleural calcification, or pleural fibrosis, and may also show asbestosis, i.e., small irregular parenchymal opacities. Symptoms characteristic of mesothelioma include shortness of breath, pain in the chest, or abdominal pain. Mesothelioma has a much longer average latency period compared with lung cancer, 40 years versus 15 to 20 years, and mesothelioma is therefore more likely to be found among workers who were first exposed to asbestos at an early age. Mesothelioma is a fatal disease. Asbestosis is pulmonary fibrosis caused by the accumulation of asbestos fibers in the lungs. Symptoms include shortness of breath, coughing, fatigue, and vague feelings of sickness. When the fibrosis worsens, shortness of breath occurs even at rest. The diagnosis of asbestosis is most commonly based on a history of exposure to asbestos, the presence of characteristic radiologic abnormalities, and inspiratory crackles, rales, and other clinical features of fibrosing lung disease. Pleural plaques and thickening may be observed on chest X-rays. Asbestosis is often a progressive disease even in the absence of continued exposure, although this appears to be a highly individualized characteristic. In severe cases, death may be caused by respiratory or cardiac failure. 4. Surveillance and preventive considerations. As noted above, exposure to asbestos has been linked to an increased risk of lung cancer, mesothelioma, gastrointestinal cancer, and asbestosis among occupationally exposed workers. Adequate screening tests to determine an employee's potential for developing serious chronic diseases, such as a cancer, from exposure to asbestos do not presently exist. However, some tests, particularly chest X-rays and pulmonary function tests, may indicate that an employee has been overexposed to asbestos, increasing his or her risk of developing exposure-related chronic diseases. It is important for the physician to become familiar with the operating conditions in which occupational exposure to asbestos is likely to occur. This is particularly important in evaluating medical and work histories and in conducting physical examinations. When an active employee has been identified as having been overexposed to asbestos, measures taken by the employer to eliminate or mitigate further exposure should also lower the risk of serious long-term consequences. The employer is required to institute a medical surveillance program for all employees who are or will be exposed to asbestos at or above the permissible exposure limit, 0.1 fiber per cubic centimeter of air. All examinations and procedures must be performed by or under the supervision of a licensed physician, at a reasonable time and place, and at no cost to the employee. Although broad latitude is given to the physician in prescribing specific tests to be included in the medical surveillance program, OSHA requires inclusion of the following elements in the routine examination. I. medical and work histories with special emphasis directed to symptoms of the respiratory system, cardiovascular system, and digestive tract. 2. Completion of the respiratory disease questionnaire contained in Appendix D. 3. A physical examination including a chest X-ray and pulmonary function test that includes measurement of the employee's forced vital capacity, FVC, and forced expiratory volume at 1 second, FEV1. 4. Any laboratory or other test that the examining physician deems by sound medical practice to be necessary. The employer is required to make the prescribed tests available at least annually to those employees covered, more often than specified if recommended by the examining physician, and upon termination of employment. The employer is required to provide the physician with the following information: a copy of this standard and appendices, a description of the employee's duties as they relate to asbestos exposure, the employee's representative level of exposure to asbestos, a description of any personal protective and respiratory equipment used, and information from previous medical examinations of the affected employee that is not otherwise available to the physician. Making this information available to the physician will aid in the evaluation of the employee's health in relation to assigned duties and fitness to wear personal protective equipment if required. The employer is required to obtain a written opinion from the examining physician containing the results of the medical examination, the physician's opinion as to whether the employee has any detected medical conditions that would place the employee at an increased risk of exposure-related disease, any recommended limitations on the employee or on the use of personal protective equipment, and a statement that the employee has been informed by the physician of the results of the medical examination and of any medical conditions related to asbestos exposure that require further explanation or treatment. This written opinion must not reveal specific findings or diagnoses unrelated to exposure to asbestos, and a copy of the opinion must be provided to the affected employee.